But I studied in India. So I started medical school in 1984. I went to Armed Forces Medical College. So I've been in medicine for 30 years formally. But my father was a doctor, and I remember accompanying him as a kid to his office. So it's probably been 45 years. I remember sitting as a child with him, talking to patients. I was most impressed by a plaque I saw in his office. I remember I was maybe 6 or 7 years old. It said, "I treat, he cures," in capital letters. And at that point, it sort of dawned upon me as I went through my career that we can just treat, and we are vessels, perhaps empty vessels. So why I went into medicine? I believe that here to make a difference. With every breath, I plant a seed of devotion. I'm a farmer of the heart. So my job towards patient care is not just plumbing and correcting their blockages or treating their heart failure, but rather a holistic approach. Getting the body, mind, and spirit in alignment, or at least this is nothing to do with religion. This is to do with them understanding, at least planting a thought or a seed in their mind to start thinking about who they are. As Rumi says, what you seek is seeking you. Protect yourself from your own thoughts. So I do share a lot of that philosophy with my patients, and over the past 2 years, my approach to patient care has changed quite a lot because I've been on this journey myself. I was in academic medicine for 10 years before I came here, and I was a professor at University of Kentucky, where Dr. Ali was my fellow, and Dr. Dineen. So I had the great privilege of training them, and from there I went to Ohio State. I was with my mentor, Dr. William Abraham, one of the brightest heart failure guys in the world. I did heart failure transplant with him for about 8 years. Dr. Ali gave me a call, "Why don't you come down and take a look at private practice?" And I came down here, and that was in 2006, and the rest is history. To touch the heart of each patient and their families, and to see the love in their eyes. It's not that one expects gratitude for one does, but when you touch another heart and that heart touches you, therein lies the reward. I'm a single parent. I have 3 boys, and so we had football the whole day, and I like to play golf. I like to read a lot of poetry, and I like solitude and silence. I do interventional, I do plumbing, so I'm the acute MI guy. I do all the coronary interventions, all the high risk and acute MIs, and I'm a heart failure guy, so I use that expertise to treat a lot of heart failure patients, and I'm able to keep a lot of them out of the hospital because I see them very frequently in the office. And my eventual dream is to build a heart failure clinic which will obviate the need for recurrent hospital admissions for heart failure. From what I've learned from my patients, I think if you give a part of yourself, a part of your heart to your patient, life is like an echo. What you send into the universe is reflected back to you. And so what I've learned from my patients is humility, kindness, and love.